I do not think patients actually know what's going on behind the scenes.
You do whatever it takes to make the sale.
I gotta love the puppy.
They'll give dogs, they'll give presents. We love holidays. It's all basically on your look too. So if you have a certain look that can get into office and get around the gatekeepers, then those are usually the people that they hire within the industry.
I worked for Pharma for 11 years.
I was a pharma rep for about 10 years.
I'm a pharmaceutical sales rep and I've been doing it for 13 years.
I'm gonna be watching Pain Hustlers.
I'm gonna do some fact checking on how this pharma hustle really works.
Own a doctor. You own your territory. You own a doctor. You own your territory. You own a doctor. Own a territory. You own a doctor.
Owning means that I am going to make sure that whatever this provider needs to feel confident and comfortable to write my product, that's my job to get that to them.
You are like the boss of your territory at that point, and you're trying to run your area.
If you do own the territory, you own the doctor. So this is very realistic.
Unacceptable. I paid for you for 5 days.
And it only took me 4 days to get turned down by every whale in the state.
Well, then you get turned down again.
What a whale is a physician that is writing you a lot of scripts.
Oh, well, that's your big fish. Every rep has a whale. That's the person that's gonna help you get all your bonuses and everything.
The speaker program is where you fly prescribers to Hawaii, Pebble Beach, and if you're doing it by the book, you get some asshole to get up there and speed read a slide deck so everyone can get back to hitting on drug reps and getting drunk in the sun. And then they fly home and they write you drugs.
You can treat them to certain perks from the companies.
You're allowed to provide food.
Everyone gives gifts. It just depends on how much your company is allowing you to do.
We pick them up at the airport, walk their dogs, sit through a folk rock serenade if that's their thing.
I think that's a little too much.
I don't know any rep that would go and walk a dog. The jets and everything, not realistic.
We lived or died by the clinic gatekeepers, and there's nothing a 50-year-old desk nurse hates more than a young hot thing half her age pulling twice her salary.
Look, lady, I need to know when I get to see the doctor.
Hey, Sylvia, how are you? Good to see you.
This is exactly what happens. Once you find that physician that likes you, then yeah, you keep it up. You continue to dress nice, you continue to give them gifts.
That's what you do, because the gatekeeper, that needs to be your best friend.
We greenlit to pilot the program in the Southeast. We're staffing up. Check it out.
If you hire pretty people, the staff will be more likely to see a woman who's a little bit more attractive.
The way you look helps a lot, depending on who you're dealing with.
They don't even really look at the resumes. It's all based on if you have charisma, if you have riz.
Oh, that's a nice perk.
I could be comfortable here.
We get bonuses.
You'll get 10% on all prescriptions that you write.
We would get trips to fabulous places, spa treatments, great dinners, but never something like that.
100%. No, 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 no.
He just wants the best cancer pain med the world's ever seen, so who gives a
Yeah,
fuck?
but if the meds are that good, why do we have to pay them?
Because if we don't, someone else will. Big Pharma's about finding that gray line, getting as close as you can without crossing over.
They do find that little gray line. Some people will do it, and some people will stay as far as they can away from it.
It's all about more money. So if they do higher doses just per patient, that's more money in your pocket.
There's nothing wrong with a little healthy competition, right?
If a patient goes in to see a physician, they just want to feel better. They have no idea what pharmaceutical sales reps do.
I got a PhD.